Good evening and welcome to First Aid for Families. I hope you are all well. I've set up my phone so I can't see the chat. Oh yes I can. Alright, let's have a look. Let's just have a look. It's typical, isn't it? I can never see the chats coming in. There we go. I can see them coming in now. Hi Katie, how are you? Are you well? Oh, it's all falling over now. It's all going very well this morning. This afternoon. Don't know what's going on. Hang on a minute. Right, there we go. I'll just wait for a few more people to pop on. I've just been on a call about mental health first aid, so that was quite interesting. And they were talking about how much alcohol you should not drink or what the limit is, and obviously caffeine. And they were talking about caffeine in chocolate, and if you have a coffee, so a small coffee from Starbucks and a small chocolate bar, you're almost over your daily caffeine limit. So that was quite interesting. And obviously they were talking about the effects of caffeine and also alcohol on mental health. And actually one of the best things for your mental health is what we probably all know is sleep. So if we get more than 7 hours sleep, then it really does improve on our mental health. So that was part of it, so that was quite good. Hi Kim, hi Cressy, how are you? We'll just wait a little bit longer. Alex, nice to see you come in. Hope you've all had a nice day, a bit blustery today. Not as warm, but let's hope for the warmer weather at the weekend, but we'll see. Now, we're going to be talking about heart attacks and first aid for a suspected heart attack. If you've got any questions as we go through, then please ask away. Hi Cressy, and I'll try and answer them for you. And if you've got any experiences that you want to share, it doesn't have to be about heart attacks. I hope you haven't had to have dealt with an out of hospital cardiac arrest or heart attack, then please pop them in the comments there. Now, heart attack and cardiac arrest, they are different things. So can anyone tell me the difference between a heart attack and a cardiac arrest? I'll just wait for a second. Silence. Okay, so a cardiac arrest is basically when the heart will stop suddenly. But a heart attack is different. There will normally be warnings that a heart attack is actually happening. So a heart attack basically is caused by a sudden obstruction to the supply of blood to the part of the heart muscle. And basically that could be a clot. The main risk to the heart there is that the heart will stop beating, therefore the casualty will stop breathing. Now it's important to say that not all, nice one Katie, that not all heart attacks will lead into cardiac arrest. It might take a bit of time to that. It might not always happen, so again, if someone is having a heart attack, it doesn't always lead to that cardiac arrest. But the important thing with a heart attack is time. We really need to make sure that we get help to that person as quickly as possible, and that's why it's really important that as first aid is that we recognise the signs and symptoms of a heart attack. We hear about the signs of heart attack. We hear about a vice-like grip to the chest. It's persistent, so it's something that's not going to go away. So sometimes we get a bit of indigestion, and people have that sense of indigestion. Again, that is a symptom of a heart attack, but it's when it doesn't go away. It's vice-like. The pain can also travel to the jaw and down one or other of the arms. It can be down both. It can be down the back as well. A lot of people talk about a pain to the left hand side of their body or down the left arm, but as I said, it can be either arm there. Now what's quite important is that sometimes in women, heart attacks manifest in a slightly different way. So the kind of recognition of a heart attack that I'm going to talk through. Oh, Katie, you've come up with the same point. So your auntie recently had a heart attack and was surprised how her symptoms were different from men's. Yeah, absolutely. So this is the kind of symptoms and the recognition that I'm going to list now is normally associated with men. I'm not saying women won't feel the same, but sometimes for women it's an indigestion, a sick feeling. There is pain, but pain can be down the back more so than through the abdomen or the front, you know. So again, we've got to be mindful of that. Now sadly, more women are likely to die of a heart attack than men, for the simple reasons we're not recognising those symptoms. And Katie, I hope, I can't read any more of your comments, but I hope that your auntie is absolutely fine. Yes, so she's actually said that she was surprised how different that feeling was, that sensation was. Okay, so the standard list of recognition is persistent vice-like grip to the chest, the pain, breathlessness as well, a feeling of severe indigestion. So, and that's really high up, very high up. Katie, good. Your auntie's fine. Good. Collapse without warning as well. So that can happen. Faint or dizziness, a sense of impending doom. This is another one that people sense. They really feel that you know, they're going to die. Something is seriously going wrong. And you sometimes see people, they crab up, they put their hands over their head, like protecting themselves like that. So again, they're getting that sense of impending doom. So their skin could be ashen, a blueness to the lips, so the cyanosis around the lips. So again, it's showing that there's a lack of oxygen to that person. Okay, a rapid, weak or irregular pulse. So again, when we're checking vital signs, we're looking for the change in the pulse rates. Sweating as well. So not only are they ashen, they are sweating. It's a profuse sweating and gasping for air as well. So again, they're very, very distressed. Again, going back to that sense of doom, they know that something is going wrong. So reassurance is really key with the casualty here. Now, what we need to do is to get them on the ground, and we don't lie them on the ground. We need them in the seated position with their knees up against their chests. So it's I call it a W position. So they're sitting with their back against the wall, their knees up, and then put something underneath their knees there. The reason for that, we want to make sure that we're not putting any pressure on the chest. So if we lie them down, all the blood is going to the vital organs and into the heart, and that might cause some problems there. So sit the casualty up. Offer them some medication. What I mean by medication, ask them if they've got angina, because some of the symptoms of a heart attack are very similar to the symptoms of angina. Now, they would have a medication called GTN, and it'll be something that they can take underneath the tongue if it's angina, and that will relieve the symptoms. If they do have angina and they do have the GTN, but it doesn't relieve the symptoms, then we're going to suspect for a heart attack. All right, so again, see about their medical history, see if they've gone through this before. All right. I'm trying to think. Aspirin. Oh, gone then. I was going to say paracetamol. Aspirin. Again, you can give them 1 aspirin. Again, that will help. That will reduce. What's the word? Something with the blood. What is the word? Someone help me out. I'll come back to it in a minute. Anyway, the aspirin, it will thin the blood. There we'll get there in the end. Help thin the blood. Now, you have to make sure that person is not allergic to aspirin, and never give aspirin to anyone under 16 years old. Okay, so that's something that we can actually do that for them. All right. Monitor their vital signs, breathing, pulse and responsiveness. Thank you, Cressy. Clotting. Good, good, good. And if the casualty stops breathing, which is a possibility, okay, we need to put them on their backs and carry out CPR. Now, the first thing that we really need to do is to call the emergency services, 999 112. Now, tell them that the casualty is breathing. They will prompt you for this, but you suspect a heart attack. This will put them up on the priority, so they will try and get to you very, very quickly. Another thing that I would probably want to have on the scene is a defibrillator. So if there is one local, it might be worth to get that. Obviously, don't let the casualty see it coming in because it might panic them a little bit further. But again, it's always better to be prepared, because at the end of the day, if that casualty does stop breathing, we need to put them on the back, and when we carry out CPR, and the defibrillator might be able to help this casualty. It will depend on what state the heart is, whether that defib is going to help or not. So again, yeah, make sure we've got that. Lots of reassurance, lots of talking to the casualty, and hopefully we can get the emergency services involved as quickly as possible. Okay, so a quick recap: call the emergency services, make the casualty comfortable by sitting them down, legs in the W position. Okay, see if they suffer from angina. You know, they might have the medications. If not, then again, we could try with the aspirin for the casualty. If we've got any, monitor the vital signs, and if the casualty stops breathing, put them on their backs and then carry out CPR. Okay, so that'll be a really key point there. Now, I was looking at some statistics from the British Heart Foundation earlier on, and they're quite scary, really. But today in the UK, on average, around 460 people die from a heart or a circulatory disease. So that's today. 280 hospital admissions on average per day will be due to a heart attack. So if we think about that, over a year, that's around 100,000 out of hospital heart attacks. So the chances of having to deal with one, hopefully, is quite slim. But it's really important that we do recognise those symptoms of a heart attack and know how to deal with them correctly. And and hopefully we can help people. And at the end of the day, people are surviving from these heart attacks. If we look back into the 1960s, 7 out of 10 people that suffered a heart attack would die. But today, 7 out of 10 people will survive. So again, you know, we can do something about it. We can help, and it's amazing how many people are surviving because of bystanders and a bit of basic first aid had I know a friend of mine, her father was having a heart attack, and luckily a lady was driving past, saw that he was had a situation, he was in trouble there, stopped and saved his life. You know, and it's great that we can hear just somebody with a little bit of knowledge can help the casualty. So that's fabulous. Now, has anyone got any questions at all about a heart attack? Just wait there. And then I'll move on to answering a question that someone put in the Facebook group earlier on yesterday. No? Okay. Someone asked me what I think is the most important thing to know about first aid. So I kind of wanted to say, yeah, all of it. You've got to know all of it. But no, if I had to pick something, then I think understanding a primary survey, what a primary survey is. And that's the Dr. ABC. So that's looking out for dangers, response, airway, breathing, and check for bleeding or circulation on there. I think if we've got a situation, so someone's ill or someone's been injured, if we go through this Dr. ABC, we can keep ourselves and them safe as far as we can and get medical response to them as quickly as possible. So people that haven't listened to the last few lives, what Dr. ABC, so if we're looking for dangers, now for most casualties or people that have an illness, we don't really want to move them. We want to keep them in a very stable position. But at the end of the day, if they're in a position of danger to themselves or you're going to have to move them. So again, move them out of the way, check for dangers, check for your own safety. I spent a lot of time working as a height safety and rescue instructor, and dealt with confined spaces as well. And we were finding that the people that were dying in those situations weren't the people that were left suspended hanging in harnesses or people down in confined spaces. It was the rescuers, it was the people coming in. to rescue that person, because if they didn't stop and think and assess the situation, they were becoming a victim themselves. So it's so important to make sure we assess the dangers around us before we just jump straight in. I'm going to say Katie here, but she'll know what I mean. So again, assessing those dangers and making sure you're safe and that they're safe in that situation. So our response, talking to that casualty, trying to gauge a level of responsiveness. If they're not responding to you, then we don't even know if that casualty is breathing. So again, check for responsiveness. If they're talking to you, they're breathing. So that's one tick. All right. If they're not, then we're going to have to investigate further. So once you've got a response or not a response, if you haven't got a response, then we go down and we open up the airway. And when we say open up the airway, that is tilting the head back and lifting the chin. Obviously the casualty is on the floor. Now just by opening up your airway like that helps with breathing. That might just be enough to get a casualty breathing again. I've known 3 or 4 incidences where someone has had an accident and they are not breathing, and all that the first aider or the first responder did was to lift the chin and open up the airway, and that actually helped the casualty. They started breathing on their own. So lifting and opening up that airway is a really important part of dealing with a non-breathing or a casualty that's not responding there. We then need to check for breathing, and we check for breathing for around 10 seconds. Because what we need to do is put our cheek to that person's mouth and check for breathing. Now, COVID-19, that kind of puts another risk factor to dealing with casualties and checking casualties for breathing, because we don't want to get too close to someone because they could be carrying it. But again, you're going to have to use your own instincts on that one. I mean, personally for me, if I see someone that I suspect is not breathing, I'd be opening up the airway and I'd be checking for the breathing. Again, we're going to talk a little bit more about this, I hope, over the next couple of weeks. But again, using your instincts there, it might be very clear that casualty is not breathing. So again, we'll talk about what we can do if we suspect that casualty has COVID-19, or even if you don't suspect, you have no idea what your first aid procedure could be there. We'll talk about that in a minute. So check for breathing. And the last thing is, if they're breathing, we're going to check for circulation, and that involves checking for bleeding. If they're bleeding out of their body or even internally, they're not circulating the blood around their body correctly. So again, we need to make sure that we check for bleeding so we can actually deal with that. Because if we don't deal with the injury, then eventually the casualty will go into shock. And as we learned from last week, the heart can actually stop. So it's really important that we do check for bleeding or other injuries there. So what do we do nowadays when it comes to doing CPR on somebody in the street? I mean, what are your guys' thoughts on what would you do, especially in this environment at the moment, with the coronavirus? How would you feel about approaching somebody? I'll put it out there first of all and see what you think. I know what I do. I just jump in, and I've had many, not arguments, lovely discussions with my fellow first aiders about this. But at the end of the day, if someone's not breathing, it's really important that we do carry out CPR with rescue breaths, especially if we're trained to do that. Obviously got face masks and things like that. That would be better. Katie, I knew you were going to answer that one. Always help, jump right in. I know. And I think a lot of people. Alex, you'd help? Yeah. Katie, I've had to give chest compression to a man who had cardiac arrest. What shocked me most was his face colour and lack of light. Yes, lack of life in the face. It can be very clear that that oxygen is not circulating around the body correctly, because obviously if the heart stops, that can't happen. And it's a very, I was going to say funny, it's not funny, it's a very ashen colour, it's a very translucent colour to the face. How did you get on there, Katie? Did he survive? I know it's a horrible question. Tam, you jump in. Yeah, it's I think, yeah, it's up to you really whether you do jump in or not. The recommendation for an adult, if you're going to carry out CPR, it sounds really harsh, but to put something over their mouth and their nose, and carry out chest compressions, and just do chest compressions without rescue breaths. The reason to put something over, he survived, and he gave you a tub of chocolate. Silver linings all the way, Katie. Well done. The reason they say put something over their mouth is when you're doing the chest compressions where you're pushing down, obviously you're pushing air back out as well. So within those particles, potentially, there could be, you know, the coronavirus, COVID-19. So that is a recommendation, is to not bother with rescue breath, but carry out chest compressions only there. Infants though, I'd always do rescue breath. The likelihood that it's a circulatory issue, the reason the heart has stopped, because in a child, is more likely to be a respiratory issue more than a circulatory issue. So children really need those rescue breaths. And as we're probably hearing in the news, that they are less likely, they are more low risk at passing COVID-19, the coronavirus, to us. So it is really imperative that, you know, if we do have a child or an infant, that we do actually carry out rescue breaths, as well as the compressions as well. Okay, but it is, isn't it? It's a tricky one. It's, you know, you want to help people at the end of the day, but I know people are quite scared at the moment, and it is absolutely up to you on how you want to deal with a casualty. But even if all you do is ring the emergency services and let them know and stay with that casualty, that's something. Okay, if you can carry out chest compressions, then brilliant. Okay, no one's going to judge you or say you've done something wrong. Okay, so please give it a go. Shelley, hi. You definitely try, but wouldn't be confident about doing the right thing. Something is always better than nothing. Yeah, sorry, someone said this to me in one of my training courses, that CPR is like sex. Something's better than nothing, apparently. And it was a guy that said that. I'm sorry if there's any guys watching here, but someone said that. So that always makes me laugh. But Shelley, yeah, always try. As I said, you won't be told off or prosecuted for just trying to help someone. Remember, we've got the SARA Act. I talked about this, I think, on one of my first live. The SARA Act is the Social Action Responsibility and Heroism Act, and that came out in 2015. And it basically protected people in the course of their duty, like the police, the emergency services, trying to do the right thing so that you can't be prosecuted. I've seen situations, and I've read of situations where a defib has been used on a casualty who fundamentally is dead. They've used a defib, they brought this guy back to life, but unfortunately where the pads were, remember it's electricity that's passed through the body at that point, it left burn marks, and the casualty tried to sue the first aider for the burn marks. Which is pretty shocking, and as you can imagine, it didn't get anywhere. It didn't go anywhere. It didn't get to court. It got thrown out anyway. The Americans, actually, they have the Good Samaritan Act, and they've had that for a very long time. And we've only just caught up with the SARA Act that came out in 2015. Okay, right. I've rambled on a little bit away from heart attacks. But have you got any questions at all that I can answer for you? It's nice to see you all on here. Sorry I didn't come live yesterday, but I've sorted my diary out so I won't double book myself again. I'll wait a second to see if you've got any questions. If not, I'll bid you a farewell, and I'll look forward to seeing you guys next week. But if you are rerunning this, stick your questions in the comment, and over the week I can come back and answer them for you. Right, I'll see you guys later. Thank you for coming. Bye.